The NCCN conference, it had been a few years since I was able to attend. And I have found that the nursing component, or like that whole day of nursing focus, makes such a difference, and creates such an inclusive environment for everybody that's there. I think it's a very powerful thing. When I first came to the Ohio State University and the James Cancer Hospital, I was I was given the privilege and the honor to be the breast cancer clinical nurse specialist. So I was focused specifically on the breast cancer program. And in nursing, we were doing some very specific work around caring and relationships as part of our way of being, so that we could best describe why primary nursing was our nursing model of choice. And part of that, relationships and caring, was the introduction and the emphasis and the intention around caring for the patient and family foremost as the core principle of why we were even in existence, and I think we could say even in business. But in order to do that, we had to have a caring relationship with ourselves, a caring relationship with our colleagues, our teams, our coworkers. And then because we are a land grant institution at the Ohio State University, we have a duty to the citizens of Ohio. And so we needed to have a caring relationship with our community. When we had our conference, we opened up our comprehensive breast center in 2011, and we decided that we were going to focus on these different caring relationships and put teams of people as part of it. And when it came to caring for self, we split that up into three different spaces: mind, body, and spirit. And so that was something that I talked about in my presentation, about how we are these complex creatures that have all of these different needs on so many different levels. And I've, since 2014, 10 years later, I've come to understand some of the nuances of that, including the fact that we have personal self-care needs and professional self-care needs. My focus in my job my focus is staff, and well-being, stress and coping, and engaging and helping to support them in activities that will support them. So maybe it's one-on-one coaching, professional development coaching, maybe it's small group work, or facilitated intentional conversations, or sometimes it's programs, and Remembrance and Renewal is one of those programs. In a way, the action, the activity, the engagement with remembering and remembrance, while in the context of a program focused on death, loss, change, and that grief, it also applies to burnout, because in a way, burnout is like a death of a dream, or a change in my expectations, or the loss of my expectations. And so coming to terms with that, being able to remember that and engage with that, and to remember my why, what brought me to the work, allows the space for renewal to happen. First and foremost, the evidence in stress, coping, and resilience has been there for decades, and that is the simple act of breathing with intention. The one body function that we have, that we can actually control with great benefit to ourselves, both mentally, physically, and spiritually, is breathing. The opportunity, the mechanisms, the physiology in place for intentional breathing allows us to interrupt stress. It's not a cure-all. Like, it's not something that has like a long half-life. When we start talking about chemotherapy drugs and their half-lives and things like that, it's not something like that. It's something that has to be practiced. It's almost like a muscle that needs to be worked on intentionally, and it helps us to get out of our primitive brain so that we can get up here into our executive functioning where we have choice. Mindfulness is a very powerful tool that helps to build resistance and create space in our brains for those times when things are hard and when things are tough. I think that's probably why we have a lot of supporting evidence for mindfulness activities in patients with cancer. So, like, we will prescribe these kinds of things or recommend these things for our patients. That is definitely a clue that it's something that we need to be engaging